Hello students, now we will see promoting good health, specific health behaviors, alcohol abuse, obesity and weight control and exercise. So in this chapter, we will see in detail about alcohol abuse and obesity. Let us now first see what health is. Health is the level of functional or metabolic efficiency of a living organism. In humans, it is the general condition of a person's mind and body, usually meaning to be free from illness, injury or pain. The World Health Organization defined health in its broadest sense in 1946 as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. And to maintain the state defined by WHO, one has to take care of their health by following a proper diet and exercise plan as well as avoiding overconsumption of anything that might create health problems. Alcohol abuse. Alcohol has been widely consumed since prehistoric times as a component of the standard diet, for hygiene or medical reasons, for its relaxant and euphoric effects, for recreational and social purposes and so on. The negative consequences of alcohol use, in particular with respect to alcohol abuse and dependence, have been for as long as alcohol has been used in human societies. The framework within which alcohol abuse and dependence has been understood has changed, however, as conceptions of addiction has changed. For example, from moral models to disease models. Moral models gave rise to the temperance movement in the 18th and 19th century, which encouraged total abstinence from alcohol. This in turn led to prohibition in the USA in the early 20th century, which made the sale of alcohol illegal, though this period was short-lived. Now alcohol is generally widely available in developed countries except in those which prohibit it for religious reasons, such as Islamic countries, but its sale is restricted. And alcoholism is influenced by genetic, psychological, social and environmental factors that have an impact on how it affects the body and behavior. The process of becoming addicted to alcohol occurs gradually. Although some people have an abnormal response to alcohol from the time they start drinking, over time drinking too much may change the normal balance of chemicals and nerve tracts in the brain associated with the experience of pleasure, judgment and the ability to exercise control over behavior. This may indeed result in craving for alcohol to restore good feelings or remove negative ones. Let's now see some of the risk factors that includes alcoholism. Study drinking over time. Drinking too much on a regular basis for an extended period of time can produce a physical dependence on alcohol, and the age of the person also matters in the risk factor. People who begin drinking at an early age are at a higher risk of problem drinking. And family history. The risk of alcoholism is higher for people who have a parent or other close relatives who have problems with alcohol. And people's mental health problems also matters. It's common for people with a mental health disorder such as anxiety, depression to have problems with alcohol and other substances. Social cultural factors also matters. Having friends or a close partner who drinks regularly could increase the risk of alcoholism. The other factor is mixing medication and alcohol. Some medications interact with alcohol, increasing its toxic effects. And drinking while taking these medications can either increase or decrease their effectiveness or could even make them dangerous. There are a number of complications involved with alcohol overconsumption. First, alcohol depresses their central nervous system. In some people, the initial reaction may be stimulation, but as they continue to drink, they become sedated. Alcohol lowers their inhibitions and affects their thoughts, emotions and judgment. And too much alcohol can also affect their speech, muscle coordination and vital centers of the brain. And people who have problem with alcohol are also more likely to have motor vehicle accidents, domestic problems, poor performance at work or school, increased likelihood of committing violent crimes, etc. And they could also have complications such as liver disease, digestive problems, heart problems, diabetes complications, problems in sexual function and menstruation, eye problems, birth defects, bone loss, neurological complications, weakened immune system and increased risk of cancer. And the signs and symptoms that may indicate a person has problem with alcohol includes loss of interest in activities and hobbies and in personal appearance, bloodshot eyes, slurred speech, problems with coordination and memory lapses, difficulties or changes in relationships with friends such as joining a new crowd, declining grades and problems in school, frequent mood changes and defensive behavior, etc. Diagnostic criteria given by DSM-4 for alcohol abuse are as follows: a maladaptive pattern of drinking leading to clinically significant impairment or distress as manifested by at least one of the following occurring within a 12-month period: recurrent use of alcohol resulting in a failure to fulfill major role obligations at work, school or at home, or recurrent alcohol use in situations in which it is physically hazardous, example, driving an automobile or operating a machine when impaired by alcohol use, or recurrent alcohol related legal problems, for example, arrests for alcohol related disorderly conduct, and continued alcohol use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of alcohol, for instance, arguments with spouse about consequences of intoxication. And one of the other criteria of DSM is that these criteria should not meet for alcohol dependence. Having now seen the complications, the risk factors involved in alcohol and how it could be assessed and diagnosed, let us now see some of the treatments and drugs that we could use with alcoholics. Treatment for alcoholism may begin with a program of detoxification, which generally takes 2 to 7 days. They may need to take sedating medications to prevent shaking, confusion or hallucinations or other withdrawal symptoms, and detoxification is usually done at an inpatient treatment center or a hospital. And they could be made to learn skills and establish a treatment plan. This usually involves alcohol treatment specialties. It might include goal setting, behavior change techniques, and use of self-help manuals and counseling and follow-up care at a treatment center. They should also be given psychological counseling. Counseling and therapy for groups and individuals help them better understand their problem with alcohol and support recovery from the psychological aspects of alcoholism. They might even benefit from family or group counseling or couple counseling, etc. And they could also be given oral medications, for example, a drug called disulfiram that helps to prevent them from drinking. It although won't cure alcoholism or remove the compulsion to drink, what it does is if they drink alcohol, the drug produces a physical reaction that may include flushing, nausea, vomiting and headaches. And there are other drugs as naltrexone, acamprosate, etc. that could be used with the alcoholics. They could even be injected medications, for example, Vivitrol. It's a version of the drug naltrexone. It's injected once in a month by a healthcare professional. And alcoholics should be given continued support. They could be sent to and after programs and support groups, for example, Alcoholics Anonymous. It's a self-help group of people recovering from alcoholism. It offers a sober peer group as an effective model for achieving total abstinence. The Alcoholics Anonymous program is built around 12 steps, which are straightforward suggestions for people who choose to lead sober lives. And as guides to recovery, the 12 steps help those with alcoholism to accept their powerlessness over alcohol. They stress the necessity for honesty about the past and present. And recovery in this group is based on accepting the unique experience of each person. Through listening and sharing stories, people who have problem drinking or are dependent on alcohol learn that they are not alone. And there are no fees for this membership. All it requires is to follow the 12 steps and a willingness to remain sober. They could even be given treatment for psychological problems. Alcoholism commonly occurs along with other mental health disorders. They may need talk therapy, psychotherapy, or psychological counseling, in addition with medications or other treatment for depression, anxiety, or other mental health conditions. And people who are involved with some type of regular spiritual practice has been found to recover from alcohol a bit easily. For many people, gaining greater insight into their spiritual side has been found to be a key element in recovery. Some alternative medicines could also be used, or techniques such as yoga, medication and acupuncture. A residential treatment program could also be adapted, where they may need to stay at a residential treatment facility, and many residential treatment programs include individual and group therapy, participating in alcoholism support groups such as the Alcoholics Anonymous, as I said, educational lectures, family involvement, activity therapy, and working with counselor and other professionals would be involved in this residential treatment program. They could even consider lifestyle and some home remedies, considering change in their social situation and developing healthy eating habits and involving themselves in activities that would not involve alcohol. Now let us move on to see obesity and weight control and exercise. Obesity is defined as having an excessive amount of body fat, and obesity is diagnosed when an individual's body mass index is 30 or higher, and body mass index is calculated by dividing their weight in kilograms by their height in meters squared. In 2008, 35% of adults aged 20 plus have been found to be overweight. It involved 34% men and 35% women. The worldwide prevalence of obesity has nearly doubled between 1980 and 2008. In 2008, 10% of men and 14% of the women in the world have been found to be obese, whereas in 1980, only 5% for men and 8% for women have been found to be obese. Therefore, an estimated 205 million men and 297 million women over the age of 20 were found to be obese, a total of more than 500 million adults worldwide. And in all WHO regions, women were more likely to be obese than men. Although there are genetic and hormonal influences on body weight, obesity occurs when people take in more calories than they burn through exercise and normal daily activities. Body stores these calories as fat, and there are various complications that are associated with obesity. It could give rise to serious health problems including high cholesterol and triglycerides, type 2 diabetes, high blood pressure, or a metabolic syndrome which involves a combination of high blood sugar, high blood pressure, high triglycerides and high cholesterol. They might even have problems such as heart disease, stroke, cancer, sleep apnea, depression, gallbladder disease, gynecologic problems, or problems with sexual behavior, osteoarthritis, or skin problems. And when people are obese, their overall quality of life also goes down. They may not be able to do things they would normally enjoy as easily as they would like. They may have trouble participating in family activities, and they might avoid public places because they might even encounter some discrimination. If a doctor believes that a person is overweight or obese, he or she will typically review their health history in detail, perform a physical exam, and recommend some tests. Taking their health history, the doctor may review their weight history, weight loss efforts, exercise habits, eating patterns, what other conditions they've had, medications, stress levels, etc. They could be checked for other health problems. And doctor would also calculate their BMI, measure their waist circumference, and perform a general physical exam which should measure their height, check vital signs such as heart rate, blood pressure and temperature, listening to their heart and lungs, and examining their abdomen, etc. They may need to work with a team of health professionals, including a nutritionist, dietitian, therapist, or an obesity specialist, to help them understand and make changes in their eating and activity habits. They can start feeling better and seeing improvements in their health by just introducing better eating and activity habits. The initial goal is a modest weight loss of around 5 to 10% of their total weight. That means that if they weigh around 200 pounds, that is around 91 kg, and are obese by BMI standards, they would need to lose only about 10 to 20 pounds, which would come around 4.5 to 9.1 kg to start seeing benefits. And all weight loss programs require changes in their eating habits and increased physical activity. The treatment methods that are right for them depend on their level of obesity, their overall health, and their willingness to participate in their weight loss plan. Therefore, the treatment tools would include dietary changes, exercise and activity, behavior change, prescription weight loss medications, and weight loss surgery. If we look at dietary changes, reducing calories and eating healthier are vital to overcoming obesity. Although they may lose weight quickly at first, slow and steady weight loss of 1 or 2 pounds a week over the long term is considered the safest way to lose weight and the best way to keep it off permanently. And obese people going on dietary changes should avoid crash diets because it might bring drastic change in them. Therefore, to lose weight and keep it off, they have to adapt healthy eating habits that they can maintain over time. And in addition to dietary changes, there also has to be increased physical activity or exercise. Most people who are able to maintain their weight loss for more than a year get regular exercise, even simply walking would do. And to boost their activity level, exercise and increased daily activity is essential. American College of Sports Medicine recommends that people who are overweight or obese get at least 150 minutes a week of moderate intensity physical activity to prevent further weight gain or to lose a modest amount of weight. But to achieve significant weight loss, they may need to get as much as 250 to 300 minutes of exercise a week. They will probably need to gradually increase the amount they exercise as their endurance and fitness improves. And to make their own exercise goal more doable, they could even break it into several segments, just doing some 5 or 6 minutes at a time. And how they can increase their daily activity is including some extra movements. For example, making simple changes throughout their day can add up to big benefits, like parking farther from store entrance and walking up to the store and doing household chores, gardening, or getting up and moving around periodically, or wearing a pedometer to track how many steps they actually take over the course of the day would be very helpful. A behavior modification program can help them make lifestyle changes, lose weight, and keep it off. Steps that could include or examining their current habits to find out what factors, stresses, or situations may have contributed to their obesity. Therefore, behavior modifications could also be called behavior therapy, as it includes counseling and support groups, etc. Counseling or therapy would help them understand why they overeat and learn healthy ways to cope with their anxiety. They can also learn how to monitor their diet and activity and understand eating triggers and cope with food cravings. Let us now see some of the prescription weight loss medication. Losing weight requires a healthy diet and regular exercise, but in certain situations, prescription weight loss medication may help. Keeping in mind though that weight loss medication is meant to be used along with diet and exercise and behavior changes and not instead of them. If they don't make these other changes in their life, medication is unlikely to work. Doctors may recommend weight loss medication if other methods of weight loss haven't worked for them or if they meet one of the following criteria. One is that if the other methods of weight loss haven't worked for them, or if they have a body mass index that is 30 or greater, or that if they have a body mass index which is greater than 27 and they also have medical complications of obesity such as diabetes, high blood pressure, or sleep apnea. Some of the weight loss medications that doctors prescribe are Orlistat. That's a weight loss medication which has been approved by the Food and Drug Administration (FDA) for long-term use in adults and children around 12 and older. What this medication does is it blocks the digestion and absorption of fat in their stomach and intestines, and unabsorbed fat is eliminated in the stool. Average weight loss with this is around 5 to 7 pounds in a year, which is more than what they can get from diet and exercise. But there are side effects to this medication, which includes oily and frequent bowel movements, bowel urgency and gas, etc. There are various other medications. One among them is Lorcaserin. It's a long-term weight loss drug approved by FDA for adults in 2012. It works by affecting chemicals in their brain that help decrease their appetite and make them feel full so that they eat less. their doctor will carefully monitor their weight loss while taking lorcaserin. If they don't lose about 5% of their total body weight within 12 weeks of taking lorcaserin, it's unlikely that the drug will work for them and the medication should be stopped. But the side effects of this medication are extreme. They could even have headaches, dizziness, fatigue, nausea, dry mouth and constipation. And in rare cases, there might be serious side effects including a chemical imbalance, serotonin syndrome, suicidal thoughts, psychiatric problems and problem with memory or comprehension. In some cases, when other methods are not working, weight loss surgery offers the best chance of losing the most weight, but it can pose serious risk. Weight loss surgeries limits the amount of food they are able to comfortably eat or decreases the absorption of food and calories, or both. So whether they are at risk of becoming obese or currently overweight or at a healthy weight, they can take steps to prevent unhealthy weight gain and related health problems. And not surprisingly, the steps to prevent weight gain are the same as the steps to lose weight, that is daily exercise and a healthy diet and a long-term commitment to watch what they eat and drink. And people who go through treatment for obesity, they need to prevent weight regain, and the best way to do this is regular physical activity and keeping track of their physical activity that would help them stay motivated and on course. So following all these preventive measures, they would avoid weight regain, and people who are at risk of becoming obese could prevent the complications involved with obesity. So in this chapter, we have seen in detail alcohol abuse and obesity and weight control. I think I've covered all the important points related to it. Thank you.